Hello, everyone. Good afternoon. My name is Saranya, and I'll be presenting my Carolina Health Informatics program internship. And today in my presentation, I'll be giving a brief walkthrough about introduction about myself and my internship. I will talk about two deliverables, one on literature review and another one on Tableau. And in the last, I'll be talking about conclusions and acknowledgements. A brief about my background. I did my undergrad in Doctor of Pharmacy at Osmania University from India. And right now I'm in my second year of Masters of Professional Science in Biomedical and Health Informatics at University of North Carolina at Chapel Hill. So coming to my interest to join this internship was that I'm from a medical background and also doing my work as a clinical pharmacist back in India. I found there's a lot of increase in maternal mortality rates and infant death rate worldwide every year. So I always wanted to understand and enhance my knowledge in all aspects of the perinatal research, and also wanted to provide awareness to the organizations and to the public to achieve all best possible outcomes for the mother and the baby. So an overview about my internship, I worked with Perinatal Research Service Center at UNC School of Medicine for my internship under my instructor, Randall Blanco, who is a co-director of the Perinatal Research Service Center. This internship has focused on perinatal clinical research, where I worked with a team of 9 other students. The internship comprises of 4 perinatal topics, and we have to select 6 recent research papers for each topic, followed by summarizing the papers, presenting the topics to the group, and providing a final perinatal deliverable. The final perinatal deliverable is provided in the form of an abstract, poster, data visualization, or an integrated data set. During the internship, we also had weekly meetings to state our progress to the team. So here's my first deliverable, the literature review. I have done literature reviews on 4 perinatal research topics, and I'll give summary for each topic. So here's my first topic, COVID-19 in pregnancy and the risk of preeclampsia. So preeclampsia happens when a woman who previously had normal blood pressure suddenly develops high blood pressure after 20 weeks of pregnancy. And it is also a major global public health and a maternal health problem, and is responsible every year for over 70,000 maternal deaths and 500,000 fetal deaths worldwide. And in the US, it is a leading cause for maternal death and severe maternal mortality. So several clinical studies reported that COVID-19 is associated with an increased risk of preeclampsia and preeclampsia-like syndrome in pregnant women. So I conducted the research to identify whether the COVID-19 causes preeclampsia-like syndrome or an actual preeclampsia, and what is the impact of it. So the studies I researched showed that the prevalence of preeclampsia in pregnant women with COVID-19 infection was 8.2%, and its occurrence among COVID-19 infected pregnant Asian women was higher than among women with other ethnicities. COVID-19 in pregnancy was not just associated with the risk of preeclampsia, but was also associated with stillbirth, preterm birth, and neonatal ICU admissions. So the underlying mechanism was that COVID-19 virus colonizes with ACE2 receptor, which is a receptor that controls the blood pressure in the maternal and fetal cells in the placenta, and that causes the preeclampsia in pregnant women. So my second study is postpartum psychosis, which is an umbrella term for postpartum mania, psychosis, psychotic depression occurring shortly after the childbirth. So it is a most severe form of childbirth-related psychiatric disorders and affects around 1 in 500 mothers after giving birth. So with adequate treatment, nearly all women with postpartum psychosis achieve full remission, and a large population of patients achieve good functional recovery. So after going through various research studies, I found a clear negative impact of bipolar disorder on mothers and their baby's health. The risk of fetuses developing severe growth retardation is increased in women with bipolar disorder, with increased neonatal readmissions and neonatal morbidity. And stillbirth is also associated with increased acute psychiatric illness within 1 year after delivery. So psychosocial support should be offered to all women in the year after delivery. So one important point I noted is that the existing studies to date do not allow to draw a definitive conclusion regarding which treatment is most effective. So there is a gap in the research on treatment of postpartum psychosis. So my third study is postpartum hemorrhage, which is also known as PPH, is when a woman is having heavy bleeding after giving birth. It usually happens within 1 day of giving birth, and it can happen up to 12 weeks after having a baby. So postpartum hemorrhage is a leading cause for pregnancy-related deaths, affecting 3 to 10% of delivery and accounts for nearly 20% of maternal deaths worldwide. One main thing is postpartum hemorrhage is preventable. So early prediction, early recognition, and intervention are crucial to reduce the likelihood of severe postpartum hemorrhage. So the studies have shown that maternal race is a major factor in risk for maternal mortality and severe morbidity, with non-Hispanic Black women being at the highest risk. So several studies have also shown that postpartum hemorrhage is associated with an increased risk in developing postnatal depression and PTSD in the year following delivery. So this group of women should be deemed as an increased risk for postnatal depression and PTSD, and careful assessment needs to be put in place for early detection and intervention. So it is always important that the timely and appropriate management for postpartum hemorrhage to be done so that the maternal mortality can be prevented. So my last study is cardiovascular disease. So cardiovascular disease complicates 1 to 4% of pregnancies and accounts for 16% of the maternal mortality, making cardiovascular disease the leading cause of death in pregnant women in developed countries. In the United States, it is now the leading cause of death in pregnant women, and in the postpartum period, accounting for 4.23 deaths per 100,000 live births. So in the US, cardiovascular disease constitute 26.5% of pregnancy-related deaths. So pregnancy complications such as preeclampsia, gestation diabetes mellitus, and preterm birth are associated with increased risk for cardiovascular disease. So by researching various studies, I found that in the US, 68% of the cardiovascular death could be prevented, and a majority of the preventable cardiac events were related to death, healthcare provider management factors, such as failure to identify the high-risk patient or underlying condition prior to pregnancy, late recognition of cardiac deterioration, and treatment not matching the best practice. So the studies have also shown that women with severe maternal morbidity may benefit from long-term surveillance and counseling to prevent or minimize future cardiovascular morbidity and mortality. So as I said, for my internship, we had to do a final deliverable. So I made a data visualization using Tableau on postpartum hemorrhage. The visualization dashboard consists of data visualizations intended to provide information and awareness for healthcare professionals and hospitals across the United States and to the public. So I have collected the data from multiple sources, such as CDC, from various research papers, and also from Maternal and Childhood Bureau. I collect all the data and entered and cleaned and analyzed the data, removed all the unnecessary data from the Excel, and I've imported all the data into Tableau to create visualizations. So the link to the visualization dashboard is on the Tableau public. So there's the link on the PPT. So let me show you the dashboard. So this dashboard explains the maternal mortality rate for top developed countries. As we can see, US has the highest mortality rate than other high-income countries, the ratio more than double than other developed countries. Even though the maternal mortality rates in the US are reducing every year, it still has the highest maternal mortality rates. This dashboard explains the trends in maternal mortality rates from the year 2000 to the year 2017 in the US. So as you can see, the maternal mortality rate has been increasing from 14.5% in the year 2000 to 17.3% in the year 2018, and these mortality rates are still increasing. So women in the US have lagged behind their counterparts than other high-income countries in terms of access to healthcare and health status. Health insurance and healthcare is critical before, during, and after pregnancy to identify and treat chronic health conditions and plan for a healthy pregnancy. This is a geospatial visualization that shows access of care during pregnancy. People may have low access to appropriate preventive prenatal and postnatal care if they live in a state with few hospitals or few birth centers providing fewer obstetric care providers. So as we can see in this map, this shows the states that are having hospitals with obstetric care and the OBGYN provider rates. As you can see, the color gradient, the middle regions of the US have low access to the pregnancy care as they have less hospitals and less OBGYN provider rates. This visualization shows the deaths according to the time of pregnancy in the US. So every patient pregnancy-related death is tragic, especially because 80% of them are preventable. Still, 700 women die each year from complications of pregnancy. So pregnancy-related death can happen anytime during pregnancy, at delivery, and even up to a year postpartum. So as we can see over here, approximately 22% of the deaths occur during pregnancy, 25% occur on the day of delivery or within a week after delivery, and 53% of pregnancy-related deaths, that is more than half, occurred 1 week to 1 year postpartum. So as I mentioned earlier, over 80% of pregnancy-related deaths were determined to be preventable. Among those preventable pregnancy-related deaths, over half of the maternal deaths are attributable to mental health conditions and postpartum hemorrhage. So according to WHO, postpartum hemorrhage is one of the leading causes for pregnancy-related deaths, affecting 3 to 10% of deliveries and accounts for nearly 25% of maternal deaths worldwide. So what are the causes of it? So although there are many causes, uterine atony is one of the main common cause and accounts for 70% of the cases. So every year, about 14 million women around the world suffer from postpartum hemorrhage. So it is important to identify the risk factors for early treatment and prevention for maternal mortality. So the potential contributing factors of postpartum hemorrhage include previous cesarean deliveries, higher rates of C-section, irregular perinatal examination, and placenta previa, and so on. So patients who experience postpartum hemorrhage can have increased morbidity and mortality, which can be attenuated by identifying patients at risk, early preparation, and increased vigilance. So maternal race is another major factor in risk for maternal mortality and severe morbidity. As we can see from the chart, the risk for severe morbidity, including and excluding transfusion, is significantly higher among non-Hispanic Black than other racial or ethnic groups. Even though Black women are at significantly higher risk for severe morbidity, but they are twice at higher risk for severe mortality. So addressing these disparities may represent an important means for reducing both overall maternal mortality and disproportionate morbidity and mortality among non-Hispanic Black women. So this dashboard explains the management for postpartum hemorrhage. So postpartum hemorrhage is the quickest of the maternal killers. That is, it can kill a healthy woman within 2 hours if not treated. So every second delay can lead to significant blood loss, thus increasing the morbidity and mortality. So therefore, it is important to prevent maternal mortality at every step during pregnancy, at delivery, and a year postpartum. So this visualization here, it shows the first line, second line agents that are used for prevention and treatment of postpartum hemorrhage. So here are a few screenshots. These are screenshots of the dashboards that I've just showed you. So coming to the conclusion, I have learned a lot from this internship. So I have enhanced my knowledge in many aspects of perinatal research. I was able to conduct in-depth research study on the leading causes of pregnancy-related deaths. I was able to identify the community that are impacted, what are the outcomes and how can it be prevented, what are the trends, what are the research gaps. So, and also giving presentation to the team on the perinatal research topic enhanced my communication and presentation skills. And for my final deliverable, I explored and learned a lot of tools to make the data visualizations using Tableau. But one challenge I initially faced in Tableau was saving the data source in Tableau. I have to extract the data in the Tableau to save the data source, which I got to know that later. So yeah, that is one of the challenges that I faced. Some takeaways to the future of perinatal research is, like, since 80% of pregnancy deaths are preventable, I suggest that healthcare organizations and the public be aware of the importance of early prediction of risk factors and early treatment to reduce the likelihood of severe pregnancy complications. So this was a main intention for me to create those dashboards. So this is it for my internship deliverable. So I would like to thank Randall Blanco for giving me the opportunity, and I also thank Randall for his guidance throughout the internship period. I also thank Perinatal Research Center for giving me an opportunity to work under them. I thank the CHIP program for giving me this internship opportunity. And I also thank my internship team for their support. And to the presentations by the team, I have enhanced my learning and I have also enhanced my knowledge on various aspects of perinatal research. These are the references for the data that I have collected. And thank you all. I'm happy to answer any questions.